Now, so far we've kind of talked about upper 1/3 facial rejuvenation, including brow lift and blepharoplasty. Let's dive in a little bit more detail into these categories. Brow lift. So what actually happens here? So when we look at this area, we've got, and again, go in terms of anatomy, we have our skin. Underneath the skin is a muscle right here, and that muscle is called a frontalis muscle. That frontalis muscle is important for lifting these brows up, for me doing that. So as I'm doing that, that frontalis muscle is essentially contracting and lifting my brows up. There are other brow elevators, but for the most part, it's the frontalis muscle. Now, if you look at a baby or someone very young, almost no one has lines in this region. Over time, what happens is that muscle and all the tissues, as they fall, that brow tends to come down. As that brow is coming down, this sends a signal to our brain to pick them up, pick them up, pick them up. And as we continually pick them up, we end up developing lines in this area. Now, some patients in the early process of that spectrum will say, hey, I got lines in this area, what can I do? You can give them a little bit of Botox to make the lines go away. Now the Botox, or Dysport, dealer's choice, is really a Band-Aid type of cure. It's not fixing the problem, it's really covering up the symptom, which is the line. Now as that process goes down the road and the patient's brow ptosis becomes more severe, you're going to need to do something more than Botox. Because if you just inject Botox to make these lines go away, you're actually going to make the problem even worse, because now that muscle that's lifting the brows up can't work, so their brows get even lower. So there's a whole lot of different types of brow lifts. So going in order, there is a direct brow lift where there's an incision that's done right in the eyebrow line. There's a mid-forehead brow lift where incisions are made right in one of these deep creases. There's a tricophytic brow lift where the incision is made right in the hairline. There's a bicororonal brow lift where the incision is made kind of like a halo from ear to ear. And then there's an endoscopic brow lift where the incisions are made tiny incisions inside the hairline. And then there's sub-variations of those. Most of the time, what I like to do is a combination endoscopic temporal brow lift. So I smash those together, and that's most of the time what I do. The temporal brow lift is made in an incision right along the hairline, right in here, inside the first couple of rows of hair. That way I can dissect down to here and lift the corner of that brow up. So most women like the corner of the brow to be lifted up so they have a little bit of angulation to the brow, and that's done through that incision. Yet almost everybody also needs a little bit of the medial elevation, and that's done through a tiny incision back here in the scalp. The reason why I like this kind of combo brow lift, it gives the best durability and long-term viability with the best cosmetic outcome. Some of the other procedures like a direct brow lift or a tricophytic brow lift do tend to have a scar for a significant period of time. It eventually fades away, but takes quite a while for that to happen. So this is kind of my rationale. This is what I like to do. So if you come in and you have aging in the upper 1/3 of the face and I see that you're a candidate for a brow lift, most likely I'm going to recommend doing a combination endoscopic with the temporal brow lift.